Alright, today we're going to go over the Pharm Exam 2 Revision 2. These are the ones that we need to know. We need to know these hard. We're going to hit them hard, so let's jump into it. Alright, what are the side effects of ibuprofen? Like GI bleeding or Stevens-Johnson syndrome. What are the nursing considerations of ibuprofen? MI or stroke. What would you take with ibuprofen? PPI. What is celecoxib used for? Osteoarthritis, RA, or pain. And what allergy are you concerned with celecoxib? Sulfa allergy. What are the side effects of acetaminophen? Hepatic necrosis. What are the side effects of allopurinol? Hypersensitivity syndrome, which is like rash, fever, eosinophilia, liver dysfunction, kidney dysfunction, GI upset, and for more than 3 years, cataracts. What is the COX-1 inhibitor? Enzyme responsible for inflammation, prostaglandins that promote platelet aggregation and protect the stomach and intestinal lining. What are some examples of fluoroquinolones? Levofloxacin and ciprofloxacin. What are the side effects of fluoroquinolones? Hepatotoxic, nephrotoxic, and Stevens-Johnson syndromes. What are the drug interactions of fluoroquinolones? Avoid NSAIDs because of seizures, increased effects of oral diabetes meds, take 2 hours apart from antacids, iron, and dairy. What are side effects of tetracyclines? Hepatotoxicity, renal toxicity, and phototoxicity. What are the drug interactions of tetracyclines? Increased effects of digoxin and warfarin, no dairy, iron, or antacids. What are the side effects of macrolides? Hepatotoxicity, nausea, vomiting, and diarrhea. What are the drug interactions of macrolides? Increased effects of digoxin and warfarin, and avoid antacids. What are the side effects of aminoglycosides? Autotoxicity and nephrotoxicity. What are the side effects of sulfonamides? Bone marrow depression, seizures, Stevens-Johnson syndrome, nephrotoxicity, and phototoxicity. Alright, what drugs, if taken with insulin, may cause hyperglycemia or lowered blood sugar control? Thiazides, glucocorticoids, oral contraceptives, thyroid drugs, and smoking. What are the signs and symptoms of hypoglycemia? Headache, dizziness, confusion, slurred speech, hunger, nervousness, anxiety, agitation, tremors, lack of coordination, sweating, tachycardia, seizures. What are the signs and symptoms of hyperglycemia? Extreme thirst, dry mucous membranes, poor skin turgor, polyuria, fruity breath, fatigue, tachycardia, Kussmaul's respirations. What are the side effects of glepamiride or glipizide? Low blood sugar, potentially sulfa allergy, and risk of developing cardiac arrhythmias. What is glucagon used for? Diabetes mellitus, hypoglycemia. What is the drug class hydrocortisone? Glucocorticoids. What is hydrocortisone used for? Adrenal insufficiency. What are the side effects of hydrocortisone? Increased appetite, sweating, headache, flushing, mood changes, altered sleep, high heart rate, high blood pressure, hyperglycemia, abnormal fat deposits, muscle wasting, edema, glaucoma, and peptic ulcers. What are the nursing considerations of hydrocortisone? Keep an emergency dose with you if you need to take it in a stressful situation. If you are sick, you need to take it for life. Don't skip doses to stop suddenly. Take in the morning with food. Monitor your blood sugar and pressure. Alright, what is the mechanism of action of estrogen? Stimulate uterus blood flow and growth of uterine muscles. What is the mechanism of action of progesterone? Suppression, contraction of smooth muscle while baby is growing. What are the side effects of progesterone? Constipation, teratogenic effects, and breast cancer. What is progesterone used for? Hormone therapy, dysfunctional urine bleeding, and infertility. What is the drug class of terbutaline? Tocolytics, a selective beta-2 adrenergic agonist. What is the mechanism of action of terbutaline? Decreases the frequency and intensity of uterine contractions to suppress but not prevent preterm labor. Decreases myosin LC kinase enzymes that stimulate uterine contractions. Side effects of terbutaline. Pulmonary edema. What is the drug class of nifedipine? Tocolytic, calcium channel blocker. What is the mechanism of action of nifedipine? Safer than terbutaline, decreases intensity and frequency of the contractions, decreases myosin LC kinase enzymes that stimulate uterine contractions. Side effects of nifedipine. Can compromise uterine placental blood flow, so when baby is born, focus on ventilation, help restore circulation. What is the mechanism of action of magnesium sulfate? Inhibits the release of ACH at the NMJ, relaxes smooth muscles. What are the side effects of magnesium sulfate? muscle weakness, hypertension, headache, dizziness, hypotonia in baby. What is magnesium used for? Stop premature labor. What is the mechanism of action of oxytocin or pitocin? Increases force, frequency, and duration of uterus contractions. What is oxytocin or pitocin used for? Post-term inductions or labor that isn't progressing. What are the side effects of oxytocin? Water intoxications. What are the contraindications of oxytocin? Uterine rupture, more than 5 births, active genital herpes, fetal distress, fetal cord lapse, any placental abnormalities, water intoxication. What is the drug class of misoprostol? NSAID, prostaglandin analog. How do we administer misoprostol? Rectally. What is the mechanism of action of misoprostol? Promotes cervical ripening. What is misoprostol used for? Used to induce labor. What are side effects of misoprostol? Hypovolemia, decreased LOC. What meds decrease contraceptive effectiveness? Rifampin, ritonavir, anti-epileptic drugs, grapefruit, St. John's wort. So contraceptives decrease the effectiveness of what meds? Warfarin, insulin, oral hypoglycemics. What are some examples of category A drugs? Thiamine, levothyroxine, dextromethorphan. Some examples of category B drugs: amoxicillin, metformin, hydrochlorothiazide, metronidazole, clindamycin. Some examples of category C drugs: tramadol, gabapentin, amlodipine, and trazodone. Some examples of category D drugs: Cinepril, alprazolam, losartan, phenytoin, lithium. Some examples of category X drugs: warfarin, methotrexate, and valproate. What is the route of aqueous humor? Produced by ciliary body, secretes it into the posterior chamber, circulates around the iris into the anterior chamber, exits the anterior chamber via the trabecular network and the canal limb. What are the side effects of Timolol? Bradycardia, AV heart block, and bronchospasms. What are the side effects of bromoridine? Dry mouth, ocular hyperemia, headache, local burning, itching, and blurred vision. What's the mechanism of action of latinopraz? Lowers IOP by facilitating aqueous humor outflow by reflexing ciliary muscles. What is the drug class of latinopraz? Prostaglandin analog. Side effects of latinopraz: harmless brown discoloration of the iris, increases pigmentation of eyelids and eyelashes, blurred vision, burning, stinging, conjunctival hyperemia. What is carbonic anhydrase inhibitors used for? Long-term treatment of POAG. What are the side effects of carbonic anhydrase inhibitors? Malaise, anorexia, fatigue, paresthesias, may cause acid-based problems, weight loss, and GI upset. What are cycloplegics? Paralyzed ciliary muscles. What do mydriatics do? Dilate the pupil, allow you to see inside the eye better. What does phenylphrine do? It's an adrenergic agonist, intraocular exam or surgery, stuff like that. Alright, how do we treat allergic conjunctivitis? Antihistamines, NSAIDs, and glucocorticoids, but you use glucocorticoids short term. What are topical glucocorticoids used for? Release inflammation and itching as a drying agent. What are the side effects of topical glucocorticoids? Thin skin, stretch mark, purpura, spider vein, excessive hair growth, maybe systemic toxicity. How do we admin topical glucocorticoids? Thin film and gently rub into the skin. Don't use occlusive bandages. Alright, why do we use methotrexate for psoriasis? Reduces proliferation of epidermal cells, but is highly toxic and should only be used in severe psoriasis. Why do we use glucocorticoids with psoriasis? It's the most commonly used one. It suppresses activity of inflammatory cells. It's a super high potency formulation. Should not be applied to face, groin, axilla, or genitalia because it may cause atrophy and secondary prevention may result. Why do we use cyclosporins for psoriasis? Inhibits proliferation of B and T cells, but may cause kidney damage, so it can only be used after other treatments have failed. Read these. And these. Boop.